Hi, and welcome back to this Wednesday edition of Focal Point on AFR Talk. Brian Fisher is my name. Program is Focal Point. Network is AFR Talk, the American Family Radio Talk Network. More content, high-definition radio, more content per cubic inch than anywhere else on your radio dial. Talking here with Tom in Dallas, Texas. And Tom, tell us again what you do.
Well, I'm a healthcare provider.
You're a healthcare provider. And you were talking about if you break your ankle, you got an Obamacare policy, you break an ankle, so you need to go to an orthopedic surgeon. There are 600 of them in Dallas, and what I thought I heard you say is you could only take your Obamacare insurance policy to 7 of those guys and get the help you need.
Yeah, on the Blue Cross Blue Shield Obamacare website, yeah.
Wow, 7 out of 600.
7. Yeah, and let me give an analogy why nobody else takes it. Say you sell Brian Burgers. They're the best hamburgers in the world, and it costs you $1 to make that hamburger. You sell it for more than that, but it costs you $1.
Uh-huh.
Well, the government comes along and says, well, the older people need access to your hamburger, so we're going to give them a Care Burger card so they can come to you and get a hamburger, and we'll reimburse you. Well, they reimburse you 95 cents for every burger that you give out on Care Burger. And then the states turn around, we need Cane Burgers and do the same thing. Well, welcome to Obamacare. They pay you 95 cents for every burger you sell. And so how many burgers do you think you got to sell to make a profit?
So in other words, what you're saying, you're basically, you're going to be losing money on every burger you sell. Then nobody can stay in business doing that.
If you sit down there, as a physician, I took a typical week and plugged in Medicare numbers of patients I saw, and I just got paid Medicare rates for everything I did. I'd have enough money to pay the electric bill and the utility and the salaries for the employees. I'd have nothing to take home.
Well, one of the ways that President Obama intends to pay for this thing is he's going to take $450 million out of Medicare. That's one of the ways. So the Medicare reimbursement rates have got to come down even further, it seems to me. And the Congress just did this doc fix with Medicare reimbursement rates, which are too low to begin with.
Yeah, well, they're just going to cut back on your benefits, what you can get. And plus the wait time, like having employees that call to schedule a test or something, they're on hold for an hour and a half getting through to get through to somebody, get approval for a procedure or a diagnostic test. So these people that are getting paid, they're sitting there for an hour and a half doing nothing, waiting you to pick up the phone so they can get approval from Obamacare to get a test done.
Let me ask you one question. I'm looking at a piece here from Reuters about insurers fear backlash over ObamaCare rate hikes. As the first Obamacare enrollment period comes to a close, U.S. insurers are already anticipating the need to raise prices for 2015 and fear that it will put them at the center of the political blame game over President Barack Obama's health care law. So we've seen some studies indicate that rates are going to double, maybe even triple. They haven't got nearly enough young invincibles, the young people, to sign up. Most of the people that are signing up are older. They have more health care costs. So they're going to have to really crank up their premium rates just to stay afloat. And so, it sounds to me, Tom, you'd be saying, look, this is a valid fear that the insurance companies have. Here's President Obama forcing them to do things they wouldn't otherwise do. It's jeopardizing their business. They may be in a position where they'll be forced by Obama to raise their insurance rates, and then the people are going to scream and complain about them instead of Obama.
Yeah. Everybody else is the bad guy. But part of it is doctors with the regular insurance are going to ask for more money because they're going to be getting paid less through Medicare. If the Medicare, you feel obligated to take care of the older people that have done their part to pay into the system. But unfortunately, until they get a way of funding this, it's just going to get worse.
Well,
personally, I think there's not a healthcare crisis in this country. There's a lifestyle crisis. There was a study that came out that said 5% of the people use 50% of the healthcare dollar.
Yeah.
And you know who those people are? They're the smokers, the people that abuse alcohol, that are overweight, that shoot each other. I mean, as a physician, it's the number of people that see that have healthcare problems because of their lifestyle is the majority of the patients you see.
Well, it used to be, Tom, that health insurers, underwriters could take those kind of lifestyle issues into consideration. They would charge a higher rate for a smoker because there are obviously health risks involved with that. They would be able, at least theoretically, I don't know how many did it, but charge a higher rate for insurance for those that are obese because obviously health risks associated with that. To me, it's kind of like, if you're buying auto insurance and you've had 2 or 3 wrecks on your career, I mean, you can get insurance, but you're going to have to pay through the nose because you're obviously a risk behind the wheel, and insurance companies in the auto industry are allowed to take that increased risk into consideration when coming up with premiums. But now President Obama will not let the health insurance companies do the same thing.
Yeah, but you get to the point where, you can't get insurance anymore, but you still drive your car. And that's the other problem with the healthcare system. We got people using the system that don't pay into it. How many unemployed people pay into the Medicare system? How many undocumented aliens pay into the healthcare system? But they go out and get sick or injured. They're there in the ER getting treated just like you and me, and they pay essentially nothing for their care.
Well, and it's, we look at Massachusetts under ObamaCare, and one of the ways this thing was sold to us is, look, all these people are going to the emergency room, but they could be going to their doctor. If we get them all insurance, get them covered, then they'll start going to their primary care physician instead of using the emergency room like a neighborhood clinic. But in Massachusetts, emergency care visits have actually gone up, not down. So it's actually increasing the use of these emergency room clinics as like neighborhood doc-in-the-box joints.
Well, it's going to turn out managed care. Oh, you got ObamaCare, it's going to be 3 months to see you. You got Medicare, it's 3 months. Because they can't afford to fill up their clinics with patients that they lose money on.
Yeah.
You have to keep openings for the paying customers. But until we get some kind of lifestyle fee into the tax system to help everybody pay into the Medicare, Medicaid, Social Security system, we're never going to solve the problem.
Well, now, one other thing, Tom, before I let you go, but you're talking about the Medicare reimbursement rate is below the cost of doing business. In other words, if a healthcare provider was depending exclusively on the Medicare or Medicaid, and Medicaid's even lower, but depending exclusively on the Medicare reimbursement rates, he would be losing money on every patient visit. So that means what he's got to do then is the patients that can pay, he's got to charge them more than he otherwise would to subsidize the customers who are reimbursing him at Medicare rates.
Right.
Yeah. All right. Well, listen, Tom, I appreciate the call. Thank you for that. And Tom's a healthcare provider. I mean, this guy's on the front lines. He's seeing it. He's seen it with his own eyes and experiencing, what is going on with Obamacare. And it was a striking thing that he said is that, look, you really got a lifestyle issue. You don't have so much a healthcare issue as you have a lifestyle issue because there's a finite number of people. He said 5% of the people in America are responsible for 50% of healthcare expenditures. And most of those 5% have to do with lifestyle issues. Now, you're going to have accidents and things like that happen that aren't related to obesity or related to alcoholism or substance abuse or smoking or something like that. And so those obviously are going to be part of healthcare coverage. It's not related to a lifestyle issue. But his point is, look, if you don't allow insurers to take lifestyle issues into account, healthcare costs are just going to go completely through the ceiling. And these Christian, the Christian medical sharing ministries, Samaritan, I forget the full name of it. Somebody help me on that. But there's a Samaritan, there's a Christian medical sharing. There are a couple of these nonprofit organizations. Medicare is what I'm talking about. These are Christian organizations, and they function like insurance. They are not insurance. They're not technically insurance, but they are enabled. They've been enabled. They got kind of a waiver to keep operating under Obamacare. And the way they work is you have to have certain lifestyle. There are certain lifestyle requirements that you have to satisfy in order to be a part of their system. And this is what Tom was talking about. If you had the same kind of thing when it came to insurance, if you allowed insurance companies to set whatever lifestyle parameters they wanted to set, and then people who satisfied those lifestyle requirements then could take advantage of the offerings of the insurance company. With Medicare and this Samaritan, I cannot think of the other name. Samaritan's part of it. But their standards are you have to abstain from alcohol and tobacco. Now, not all Christians do that. We've talked about this before. Drinking is not a sin in and of itself. Drunkenness always is. But drinking itself, biblically, is not a sin. But the Now, the Medicare people say, look, that's just a requirement we've got. You have to be a Christian. You've got to be involved in your church. You got to abstain from alcohol, and you got to abstain from alcoholic beverages. Now, tobacco, I mean, smoking a pipe, smoking a cigar, no health risks involved in those whatsoever. Even the American Cancer Society says that. But they say, look, this is just simply a requirement that we have. So if you have certain lifestyle requirements and you can meet those, then you can be a part of the Medicare or the Samaritan system. And what you spend monthly is far, far lower than anything you could do out there in the insurance market. I mean, you may be spending several $100s a month to provide for your family of 4. And then when you have a health care need, then the other people that are paying into the system will send their monthly obligation directly to you. And they'll send you a note of encouragement. They will let you know that they are praying for you. They will want updates on how your surgery or your recovery is proceeding. And they're able to do that. And the reason that the cost of health care is so much lower with something like Medicare is that they are able to take lifestyle factors into account and say, look, not everybody is going to be able to take advantage of what we offer. You know, there are some automobile insurers that will not underwrite you. If you've had X number of moving violations or you've been involved in X number of accidents, they won't even underwrite you. Now, there are people that will. I mean, anybody, just about anybody can get auto insurance, but if you've got a spotty driving record, you may have to pay through the nose for health insurance. And like Tom was saying, a lot of people, when the price gets too high, they just don't bother to get car insurance. And then when they get into a wreck, then the victim is completely on the hook for all of the costs, which is why you have uninsured. You know, Debbie and I, we pay for uninsured motorist coverage in case we get hit by somebody that doesn't have insurance. The last 2 times I got hit, I wasn't at fault either time, but the last 2 times, the guy that hit me didn't have insurance, and so I had to rely on the fact that I had paid every month, to have coverage in case I got hit by an uninsured motorist. You know, and it's supposed to be illegal to drive around without insurance. So why do I have to buy insurance when the other guy is legally obligated to provide it? But that's the system we've got. Anyway, Focal Point AFR Talk. We'll be back with more. Stay with us. Be right back.
Life